My name is Jerry Trigueros. I am the Vice President of Patient Services for Northern Nevada Hopes. So Northern Nevada Hopes is a primary care federally qualified health center, community health center, located in Reno, Nevada, and we're actually in the process of expanding at the moment into another facility, which is scary for us, but tells you how much the city has been growing. We offer many different services from primary care to pediatric patients, adults as well. And we have many on-site services such as x-ray, our labs, pharmacy, we have transportation for our patients. We really have the wraparound services that we feel are needed to everyday individuals to be able to get to their health needs. Having access to languages is so important because as an FQHC, we are required to also, by the federal government, to see and screen all refugees that come into the state and into Northern Nevada. That's one of our big pieces, but just all around. The moment you offer services, discounted services for uninsured patients, it becomes an influx of people in the community who are in need of health care that aren't able to access it. And they all come from all different walks of life. So we get, at the moment, I want to say we have roughly, at least 10 different languages that we're serving or using, but it's definitely more than that. And that just goes to show that we have a very diverse population of patients that we serve. Before Boost Lingo, we were actually relying a lot on whether having staff on site that might have known the language. We've had one of our medical providers who spoke Mandarin, and we're like, hey, is she available? Can we get her over here? We need her help. Or especially with our Spanish-speaking patients, we would ask, do you have a family member here with you today that can help you out? With any of our providers who might not speak Spanish. So it was really kind of a risky way to go about it. And as we started to grow, we started to realize we couldn't keep running our resources thin like that. And, relying on family members or other staff that were doing their job, whatever that might be, and we were pulling them from it. So we actually had, prior to Boost Lingo, had also connected with locally, there is called the Language Bank, and it's the university. And they were coming in person. The big hurdle we ran into there, I'll say, is we were having patients that might not show up to their appointment, but the Language Bank was sending someone in person. So we had to pay minimum 2 hours for that service. And as a nonprofit health center, that gets very pricey and kind of can't keep the lights on for too much longer if we're just going to keep doing that. So we had to look for other ways to go about this where we could still meet our patients where they're at and provide the interpretation they need without taking as much of a loss if the patient did not show up. When we were looking to, in a way, outsource this possibly and looking for other options for language services, we were possibly looking at 4 to 5 different services. What we first did is actually called a couple other community health centers. And obviously number one was price. Price was number one. We were then looking at what is the minimum usage that we had to use. At this time also, we didn't have much data. The services were being provided, and in the system, all we had was, in our EMR, was a flag per se that just said patient needs the following language, but we weren't tracking it. We didn't know how many minutes, what are the languages, none of that. So we came down to choosing Boost Lingo because of everything I just mentioned, whether it was price. We didn't feel like we were being tied into a crazy minimum amount of minutes that we didn't know if we could upkeep. And lastly, the information and the data that we get. As a nonprofit, data is like the heartbeat of an organization, and the data we were able to look at and identify and even show when we're going to be requesting a grant to help pay for these things. The data is our go-to. First, how readily available it is. Boost Lingo is readily available. When you have a 20-minute visit with a patient, that's how long our established patient visits are. And when you have 20 minutes and you both don't speak the same language, that often is already going to reduce that to, definitely less than 20-minute visit because there is a language barrier. And so Boost Lingo is readily available to where, that was one of our other worries, was how quick can we get someone on the line? And we have these mobile, we call them the walking robots, but they are these mobile units that we have on wheels that also have video capability if needed. But we pull those in, our medical assistants pull those into the exam room, and they're able to, within, I want to say within seconds, is the majority of our languages that we're able to get in touch with someone. So for me, from an operational perspective, I'm constantly looking at no-shows and our utilization rate. How can we best maximize with the time that our providers have with our patients? This is just perfect in the fact that we know we aren't having to have a lag or a delay in care or in time because we are able to rely on Boost Lingo to provide the interpretation right there and right away. So, me personally, working with the interpreters from Boost Lingo, I don't have as much experience, but I'll tell you, especially during our implementation phase, I was part of that team, and we would call in different languages, and we had I think we got like a demo session where we could try things out so that we could just see what it was like. And from what I hear, even to our clinical operations team, they enjoy the fact that even if the patient might even need to see the person in video, for example, to help with the interpretation, just makes it so much easier for them. So I would say firsthand, it's been a while since I've actually experienced using it, but as part of one of the people who had the sales pitch to our staff of this being much better for us, I could say that I wasn't let down and they weren't either, and they believed me and they trusted me along with the rest of our team, and they do to this day. And now I don't know exactly how many years, but I know it's been at least a couple years that we've been using Boost Lingo, and we have had no reason to even look at anywhere else because we just know that it's seamlessly been a part of our day-to-day workflow and a part of our organization. I would say mine, and I can speak to the organization on this, our experience with Boost Lingo has been seamless. It's been a partnership and or a relationship that we feel that was much needed, and we are just lucky that we landed on and made the right decision a few years ago when we were presented with a few options and weren't experts of this. It was a small clinic. At that time, I want to say we were roughly around 2,000 patients. Now we're hovering right over 13,000 patients and about to open our second facility that'll be bigger than this facility. So more than ever, we've really leaned on Boost Lingo to help us with that interpretation gap that we had, and it's been great. And if I could tell someone else who's possibly out there searching, is to give this a shot, because we work with anyone and everyone, and closing that language barrier has been one of the best decisions we could have made, and also making it easier to access. I think how quick you can connect with an interpreter is something everyone should be looking at, and with Boost Lingo, we have not had to worry about that. Someone is available at all times. I would say the biggest impact that Boost Lingo has had, once again, it's in the exam room. Right now, we've had an influx of refugee patients, and it is difficult to have all of our staff immediately catch on or be trained or learn right away the cultural sensitivity that is needed to work with patients from different countries and different cultures just in general. And I think sometimes it's crazy how language does that. Language can be the comfort someone needs. And to some of our patients, just knowing there's going to be someone there, maybe they're not in person, but that we have a walking robot there that's going to bring that language to them. That's the comfort that helps them ease a little bit so that they don't feel like they're in somewhere where they don't belong. That's I think the biggest impact Boost Lingo has had on us, is taking that. We've never imagined that it would do this for us. It's really taken some weight off of us in the sense of having patients who are not from here, and what can we do to make this a welcoming environment, and also be able to meet the needs of the patient today and help. And the language does that. Boost Lingo does that.